Hey, do you teach yoga? Have you ever trained to lead yoga classes, to be a yoga therapist? Have you ever owned a yoga studio? Maybe even just wondered what it was like for the women and men up there in front of the room on their mats, leading you through endless Surya Namaskars, down dogs, and pranayamas galore? Well, these are their stories, and mine. I'm Rebecca Sebastian, a 20-year yoga teacher, 10-year yoga therapist, yoga studio owner, and co-founder of a yoga-focused nonprofit. I've done a lot in the yoga world over the last 20 years, pretty much everything except had a water cooler. You know, a place to share stories, talk about struggles, successes, and find other people who do the same thing that I do. Welcome to Working in Yoga, a podcast and substitute water cooler for yoga folks to connect and build community, to share our unique profession, our challenges, and our journeys with the world.
Hey friends, welcome to Working in Yoga. This week on the podcast, I have my friend Dr. Steffany Moonaz back on to talk about yoga therapy, licenses, and some interesting things that she's researching about the work in acupuncture. I really want to have this chat because I think that there's a lot that we can learn from the world of acupuncture, as well as from learning the industry journeys of other professionals like massage therapists and chiropractic care. We need to know what other industries have done so we can chart our future with as much information as possible. I also want to give you some context for this chat. Steffany and I recorded this on November 6th of this year, the day that we found out the results of the recent United States presidential election. So we were both feeling kind of somber before we started, but then rallied and were able to chat about yoga therapy so that you all could listen. Within that framework, Steffany and I were talking about yoga therapy as an industry and our future. This becomes even more relevant for us in the United States as potential tariffs go into place next year that could possibly make the price of basic necessities go up for everyone. And guess what usually gets cut out of budgets first? Things like yoga. So I really want to pay attention to this for us in North America, the United States specifically, and I will keep you all updated as we go forward to see how this looks to shape up for us as an industry in the very near future. Before we begin though, if you haven't, could you do the whole like, subscribe thing from wherever you're listening? This helps more people find and join the conversation, thanks to us deciding to feed that very hungry algorithm that shows the podcast to other people. Right now, I am sponsor free on the podcast because I want to make sure that I can share whatever it is that I want about the yoga industry on here. But if you're keen to serve tea in your yoga classes, I do run a tea and spice shop, and we could set you up with a signature blend for your yoga studio or your yoga classes. Take a peek at our offerings at www.thesunlightexperience.com and click the Apothecary tab. Now, let's get into our conversation with none other than Dr. Steffany Moonaz.
Hey friends, welcome to Working in Yoga. Okay, so this is my second conversation with my friend Steffany Moonaz, and we are going to talk about all sorts of interesting things with yoga therapy and acupuncture and healthcare. And I just have to say, Steffany, before you tell everybody who you are and what you do, I totally just changed my entire demeanor. We are recording on the day of the election. And we were so somber just moments ago, and then I was so perky. We're going to do it. Tell everybody who you are and what you do, my friend.
Thank you so much. It's an honor to be here, and I'm so grateful for what you do and this space that you have created to be able to have these conversations, and to give me something else to think and talk about on this particular day. So thank you for that. Okay, so I'm a yoga therapist. I have a clinical practice. I specialize in working with people living with various forms of arthritis and chronic pain conditions. I also, my day job, quote unquote, is that I'm a research scientist. I have a PhD in public health, and my research career is focused on the application of yoga and other integrative health practices to the management of various forms of arthritis and chronic pain. In that space, I'm particularly interested in issues of access and the intersection of chronic pain with substance use disorder.
So here is why we started talking about this subject, is that you and I have had these conversations in the Future of Yoga Therapy group. And one of the main conversations that I've seen really popping up in the yoga therapy group is, do we belong in a traditional medical Western healthcare setting? I think there are some ideas that we're going to get paid better in that setting, that we are going to be able to practice the way that we're practicing in private practice. So I want you to debunk, possibly, if that's the case, or validate and confirm those thoughts, because you have more expertise than 99.9% of others.
Okay, so thank you. There are different types of ways to be integrated into healthcare settings. A barrier that some yoga therapists have had to getting into healthcare spaces is that we are an unlicensed profession. And when a hospital administrator is making decisions about what to offer and who to bring in, a license is something that they understand. A license is a credential that says you have sufficient training that has been verified that you are going to be able to deliver this modality in an appropriate way, keep our patients safe, in addition to obviously needing things like liability insurance, et cetera. Also, many of those licensed professions can bill their services to insurance, various forms of insurance. Now, that varies widely. Just because you're a licensed professional does not mean that you can necessarily bill insurance, and we can get into that a little bit further. But also, having a license still doesn't mean that you can necessarily get into a healthcare setting. So, a hospital administrator, for example, could say, yes, I understand that you have a license, but we don't necessarily need or want this particular approach because our patients aren't asking for it, because we think that it's a liability, because we don't have space, because we have somebody else who does that. And the we have somebody else who does that is what I sort of want to dig into, because there are licensed healthcare professions that have a scope of practice that at least overlaps with the scope of practice of yoga therapy. And so there are other people who already have a license who are able to deliver yoga either within the scope of their license or because they also are a yoga teacher. And so, for example, if they are a physical therapist or an occupational therapist or a psychotherapist, they might offer some of yoga's practices under the umbrella of that license. And or they may happen to also be a yoga teacher and therefore are already on salary at the hospital and can teach classes in a way that is probably safe because they have this other healthcare license that means they know how to work with patient populations. And that probably is true. What they do is very different from what yoga therapy does. Most hospital administrators have no idea that there's a such thing as yoga therapy, or that yoga therapy differs from teaching a yoga class to people who have a clinical condition, nor are they necessarily interested in that distinction. That's starting to change in some spaces, like the VA, for example, that has really clear job descriptions for yoga therapy and yoga teaching. And the VA is at the forefront of integrating complementary health practices into their whole health approach. Um, but I want to draw the parallel, and I think this is where you want to go, Rebecca, of acupuncture, because
Yes.
acupuncture is a licensed healthcare profession. Licensed acupuncturists receive training far beyond what yoga therapists get, right? So they're getting like probably 3,000 hours of training compared to our standard of 1,000, right? 200 for a yoga teacher training and then 800 plus for the yoga therapy training. And many of us go on to get additional continuing education. But the standard training for a licensed acupuncturist is more at the at least master's level But now the standard is becoming more at the doctoral level. So these clinicians tend to have a doctorate in acupuncture and also a license. There's a board exam, all of the trappings of having a healthcare license. So these are incredibly well trained and licensed healthcare providers. Some of them work in private practice. Some of them bill insurance. Insurance coverage for acupuncture varies. Sometimes you need a referral from a conventional healthcare provider to acupuncture in order to receive it. Sometimes it has to be only for a certain diagnosis. Sometimes it can only be a certain course of care. And so those who are arguing against licensure, part of what they're saying is we don't want an insurance company telling us who we're allowed to provide care to, what kind of care we can provide, how long we can provide care, which is certainly true. Once you get into what is insurance is not going to cover an unlimited course of care for absolutely everybody, right? They're going to put limits on what that is and how that's accessed, and that varies. And you don't necessarily see acupuncture in every healthcare setting. Does your local hospital offer acupuncture? And do they have a licensed acupuncturist on staff who is offering acupuncture to anyone who wants it, or for any doctor who might want to make a referral? Probably not. There are some places where that is happening, but it's not standard necessarily. But I want to highlight a research study that we're doing in particular right now around Medicare's coverage of acupuncture, because I think it's emblematic of this issue. So at Southern California University of Health Sciences, we have a research grant from the National Center of Complementary and Integrative Health. So that's the branch of the National Institutes of Health that studies integrative approaches, including yoga and including acupuncture. And they gave us a decent sized grant and 3 years of time to study this one particular situation, which is several years ago, Medicare, which is available to every American 65 and over, and some people who are younger and qualify for other reasons. For only low back pain, they can receive acupuncture. However, that acupuncture has to be provided by or supervised by a conventional medical healthcare professional. So all of these people that I was talking about who have 3,000 to 4,000 hours of training and a doctoral degree in acupuncture cannot provide acupuncture that is covered by Medicare unless they happen to also be a conventional healthcare provider, right? Like they're an MD and also have a doctorate in acupuncture. There are some of those. Or they have a medical provider, a nurse practitioner, or a medical doctor who is overseeing them, which means maybe they are working in a hospital setting, or maybe they are in an integrative facility that has a medical doctor that is supervising all of the care. However, okay, so that's the situation for a licensed healthcare provider, right? So they have 3,000 plus hours of training, doctoral degree, they have a license, and they can't provide acupuncture to people with low back pain, even though it's covered under Medicare, let alone that it's not covered under Medicare for absolutely any other reason. It's only chronic low back pain. But there is something called a medical acupuncturist, and a medical acupuncturist receives 300 hours of training. In some cases, it may be as low as 100 hours of training. Okay, so 100 to 300 hours of training. And this varies by state. In fact, in some states, they need almost no training to provide acupuncture under their medical license. So a medical doctor can be trained for 100 to 300 hours, and their approach to acupuncture is not based on necessarily this like ancient system of therapeutics that includes Chinese philosophy and understanding of how energy moves through the body and organ systems, right? It's a very different approach that mostly aims to address pain and to release muscle tension, right? So it's a really different model. And also, physical therapists with very little or no training can do something called dry needling, which is under
Yes.
their license. And that
Yes.
also is covered. And they don't learn anything about Chinese medicine, but they can use needles at certain points, like, a trigger point, for example,
Yeah.
in order to relieve pain and reduce tension. They are covered to be able to treat people who have chronic low back pain under Medicare. So what we're trying to understand in our research study is three things. And then we can get into what does this have to do with yoga and what
Yeah.
are our
Yeah.
concerns? Okay. So our first question is, what's the difference between people who got acupuncture and people who got standard conventional care in terms of, is it safer? Is it more cost effective? And do we reduce the likelihood that they're going to need more serious procedures? Now, the acupuncture that they're getting may be acupuncture delivered in the ancient Chinese system, and it may be acupuncture that they're getting that, somebody has gotten 100 hours to be able to do. So that's question one. Question two is the acupuncture supply. Chronic low back pain is incredibly prevalent, and it's especially prevalent for people who are age 65 and over. So there is a very high need for people to be able to access non-pharmacological approaches to manage pain, like yoga, like acupuncture. But if only medical providers can deliver this, we don't think the supply is sufficient. There just aren't enough people to be able to deliver the care, to be able, if we want to have a public health impact, we want to be able to transform
Yeah.
the experience of chronic low back pain. We need more people to be able to provide acupuncture. And right now, it's very limited. And also, we know that the access is likely inequitable. Some people can access it and some people can't because the supply is not equally distributed. And then the last question we want to ask is, what are the facilitators and barriers? So what makes it easier or harder for acupuncture providers to deliver care for Medicare recipients with chronic low back pain? And we suspect one of the barriers is, well, I have to be supervised by a medical doctor or else I can't do it,
Yeah.
right? Or even I didn't know I could bill Medicare, or the reimbursement is so low, and that's an entirely different issue. Medical doctors don't necessarily want to bill Medicare for treating chronic low back pain because the reimbursement is so low. And then lastly, on the patient side, people who are living with chronic low back pain, why aren't you getting acupuncture? Maybe it's because you didn't know about it. Maybe because there isn't an acupuncturist near you. Maybe, a whole variety of other access types of issues. But because we're studying this decision, it really, was immediately clear to me that we are creating a parallel situation in yoga therapy, which I have cautioned about for a while now because, you know, this is getting back to politics again. We need to learn from history, right? We need to look back and say, maybe that didn't work out so well, and we shouldn't do it again. And that seems like what we may be doing. And so may we look at this from all angles and learn to not replicate a system that doesn't seem to work well.
Okay, this is like the Q designation. This is, I mean, like to the hours. This is okay. Like, is this the inspiration? Is this just where you think the IAYT got the idea to start the Q designation for licensed healthcare practitioners? Now, this is episode 4 in a long series about the Q designation. We've heard from Leslie Kaminoff and Amy Wheeler and Stevie Ingram. Like, okay, is this just a copy? Or are we copying acupuncture? It feels like it.
I can't speak to the motivations of IAYT. I would be surprised if somebody said, "Oh, look, acupuncture did this. We should do it too." What I think is happening, and this is something that they have said, is this is already happening, right? So
Yeah.
here's what's already happening. One, licensed healthcare providers are delivering yoga in healthcare settings.
Yes.
PTs are offering yoga, OTs are offering yoga, psychotherapists are offering yoga, medical doctors who have some yoga training are offering yoga. Not necessarily a bad thing. If a medical doctor teaches a patient how to breathe, that's pretty cool. It doesn't take
Yeah.
the place of yoga therapy, but it's already happening. And wouldn't it be great if those people had more training about yoga? So I do think it makes sense to have specialized training for healthcare providers to use yoga under their license, maybe even delivered through
Sure.
IAYT to say, listen, if you're going to be delivering yoga under your license, we want to make sure you have some foundational understanding of the whole system of yoga, what it is that you're doing so that you can be using it responsibly. They don't necessarily have to become a yoga therapist to, for example, you're doing PT exercises and you teach somebody how to coordinate breath and movement. That's,
Yeah.
maybe not a bad skill for them to have. Okay. The other thing, though, is that these trainings had already started to pop up. There were a few of them that existed that I guess due to, market demand for, or somebody saw an opening. Who knows? It wasn't
Maybe.
IAYT that created the first 300-hour yoga program for healthcare
Yeah.
providers. And so I think IAYT saw a little bit of that happening and said, if that's going to happen, we should be the ones controlling it, or it should be happening through us, whether or not that was protective or whether or not it was opportunistic, I can't speak to. I think that where it missed the mark was thinking, oh, this is going to be a way for healthcare professionals to learn more about yoga therapy and become a referral source for IYTs, or, to say that you get a credential that's not a certification, and that distinction when people already have no idea what yoga therapy is
Yeah.
or what it means. And now we're complicating it further instead of saying, here's a bridge. So if you already are a healthcare provider, let's say you're a PT and you are interested in being able to bring some of the tools of yoga into your PT, teach them how to be mindful while they do the exercise. Awesome. Let's give you that skill set. That's one skill set. The other skill set is becoming a yoga therapist. And so, how do we make it possible for you who already knows a whole lot of anatomy and physiology, probably more than a lot of yoga
Yeah.
therapists? So, how do we create a bridge for you to become a yoga therapist and get credit for or exemption from some of the skills that you already have based on your license, right? So a PT may not need the same information about anatomy. A psychotherapist may not need the same understanding of like the models of mental health from a Western perspective. And so is there a way to create a bridge for them to become a bona fide yoga therapist with, some reduced hours or some credit or some exemption? That's pretty standard. So, in my mind, either you use a little bit of yoga in your existing license and you get some training about how to do that appropriately, or you get a bridge to become a yoga therapist, but not this sort of in between, I'm this other thing that has a queue and because
Yeah.
I'm already in a hospital, an administrator is going to be like, okay, great, do that. They're not going to bring in a CIAYT to the hospital.
Right. So, okay, I have a few questions, partially because I want to draw this parallel more with acupuncture and yoga
Yeah,
therapists. My first question, are there acupuncturists who are operating without a license? Is that a thing? Or do they all have to have a license?
a medical acupuncturist doesn't have an acupuncture license. They have, so everyone who
Whatever their
delivers,
other one
right,
is.
everyone who delivers acupuncture has to be licensed either as an acupuncturist or as another healthcare professional that has acupuncture within their scope. So any medical doctor, nurse practitioner, physical therapist can deliver acupuncture under that license, or they have to be licensed as an acupuncturist. You can't stick needles into people without a license. Legally,
Okay.
anyway.
So then extrapolating from there, if we're going to forecast yoga therapists, say 5-10 years down the road, and we do shift in this direction of the sort of like Western healthcare model, and some yoga therapists do move to get licensed, that means we all have to be licensed, correct? I mean, there will be, do you see there to be a way where those who choose not to participate in that model still get to actually work as yoga therapists?
Yeah. So one thing is that licensure can happen statewide versus nationally. And so it may be, so these laws about, for example, what a medical doctor can do, what the requirements are for a medical doctor to be able to use acupuncture, it varies by state. And that's
Right.
one of the things that we're researching now is what are the differences state by state, because it's not uniform. And so it's possible that a license might be required in one state and not required in another state. It's also possible that it becomes national, like, the medical board, which
Yeah.
is national, right? Um, there also could be sort of a tiered system where you're able to deliver the same services under a license or not under a license. So you could be a counselor and not be licensed, or you could
Yeah.
be like a social worker and have a license. And so you could be delivering similar services under a license or not under a license. So there may be slightly different models. And then that gets into what is the difference between teaching yoga and yoga
Yeah.
therapy. And while IAYT wants to say that there is this clear line in the sand between them, like if you do an intake and an assessment and a care plan, then it's yoga therapy. But there is so much gray between yoga teaching and yoga therapy. And yoga teaching is not healthcare, it's education. And
Yeah.
so, how do we say, all right, well, this is where the line exists between teaching and therapy, and you need to be licensed, and you're an educator, which doesn't require a license.
So if we get licensed, do we get actual payment? I mean, I feel like this is one of those like myths, right? It's like a unicorn in the air. We're going to get two things. Like from what I see, excuse me, we want two things. We want gravitas for our work. We want
Right.
to feel like what we do is important, and we want to get paid a living wage for what we do. Right now, we have neither of those things.
Right.
So we're real sad about it.
Yeah. Okay.
Is
So
license going to fix that?
licensure definitely helps with the former. A license is something that healthcare understands.
Yes.
You have a license, that will probably open doors. That does not mean that you necessarily, it's not a prerequisite necessarily to being able to bill insurance, because there are people who are yoga therapists now who are billing insurance, right?
Yep.
Because they're in a setting where insurance can be billed. Either they're in a situation where they're supervised, or they're in a healthcare system, they're part of a bundle, et cetera. So there are ways that billing can happen aside from licensure. And also licensure doesn't necessarily mean insurance coverage, as we laid out in the example of licensed acupuncturists cannot bill to Medicare. Medicare is one insurer. It's a very big insurer. But every insurance company is different. And so being able to bill under this insurance doesn't mean you're able to bill under that insurance, right? It's not necessarily true that because you have a license, you'll be able to bill any insurance company. And as I pointed out previously, you might not be able to bill for the conditions that you are seeing. You might not be able to bill for the number of sessions that you think are appropriate. You may not be able to bill without a referral from a medical doctor, which means they need to schedule a visit to their medical doctor, pay their copay, see that doctor, get a referral, is that doctor going to refer to you, or are they going to refer to somebody who's already working in their hospital who
Yep.
now can bill yoga to insurance? And also, there may be parameters on what you're actually allowed to deliver, what gets covered, right? So, for example, a lot of acupuncturists also use Chinese herbs. You cannot bill insurance for Chinese herbs, right? And so you may be delivering a comprehensive care system, but only this little carve out is what you're allowed to bill for. Similarly, with chiropractic care, for example. So you can
Yes.
bill for, you can bill for the spinal manipulation, but you may not be able to bill for all of the different aspects of chiropractic care and the amount that you can get reimbursed. So, how much does a chiropractor get reimbursed to provide some education about, healthy
Yep.
exercise approaches versus what they can bill for using a TENS unit versus what they can bill for the spinal manipulation? And as I said, one of the barriers to even medical doctors providing acupuncture under Medicare is the reimbursement is so low that it's like not even worth the paperwork. The other issue becomes, and I've heard this brought up in some yoga therapy conversations, you need like an entire staff person just to
Yes.
do the billing, right? Because it's not just like if we are so fortunate as to be able to bill Medicare or Medicaid, it's Medicare, it's Medicaid, it's Blue Cross, it's Anthem, it's Kaiser, it's like whatever all this like laundry list of insurance companies are. If you only take one, then you can only see people who have that particular insurance. And then what about people who don't have insurance, right? That's a whole, like if we want, I think that there are a few things that we want to happen with being able to bill insurance. One is we want to get paid a living wage. I don't know that insurance gets us a living wage. In addition to now we have to pay the person who's doing all of the paperwork. And where does their pay come from? It comes from the money that we're bringing in through reimbursement, which is less than what we would charge in the open market. And then I think another reason why we want to bill insurance is because we believe that it will make yoga therapy available to more people, people who can't pay
Yes.
out of pocket. That may or may not be true because do they
Mm.
have a copay, for example? Can they afford
Yes.
the copay? And can you afford to deliver care when the reimbursement rate is so low? So I do think that there are other models for how we can make yoga therapy more accessible to people who can't afford to pay. And there are some people who are going to want to go the insurance route. I mean, if you look at psychotherapy, there are people who take insurance and they bill insurance. And, there are some people who say, listen, I'm not going to deal with your insurance company, but I'll give you a super bill and you can
Yep.
deal with your insurance company. Or they say, I'm a cash only practice and you can pay me with dollars or Venmo or a check, but I'm not dealing with insurance. And so that is something that could happen in yoga therapy as well. There could always be people who decide that they don't want to deal with insurance. So it's not like if we get a license, we are all going to have to work with insurance companies. That's a choice. And it may not be the panacea that some people think that it will be.
So, real talk here. I have had a whole lot of conversations over the last 50 days or so about insurance specifically and licensure specifically. Can we actually get a license? I mean, do we have the science behind us? Do we have the research behind us? Do we have the actual like do we even have a shot? Is this a conversation that is actually realistically worth having in the next 20 years?
Um, I actually do think that we could get licensure. I
Okay.
I'll tell you why, but just because we could doesn't mean we should.
Yeah.
Okay. So the reason why I think we could is because IAYT has actually been laying the groundwork for licensure, which I IAYT in the past decade has been operating under the idea that like increased professionalization means taking the steps that a healthcare profession takes, whether or not we actually want licensure, which is a conversation that will happen in the field when the time comes. We can go all the way up to that point and decide not to do it, but we will still benefit from the steps toward increasing professionalization. And in fact, another line of thinking in, conversations uh, at tables where IAYT is talking with other licensed healthcare professionals is, if we take these steps in the direction of licensure, we are essentially self-governing. We are showing that we are able to become a profession that takes care of itself. We are self-regulating, and therefore we don't need the US government, to come regulate us. If we were completely unregulated and completely all of the map and had no standards and were doing all kinds of crazy nonsense, then that gives the government more reason to say, this is not okay. You guys have got to do this stuff, to get in line, and we're going to need you to adhere to our standards. So the things that IAYT has done, that the field of yoga therapy has done, that lay the foundation for us to ultimately qualify for licensure are: one, we have competencies. We have things that we have to know in order to be considered a yoga therapist under our profession. Two, we have accreditation of training programs. So we have the schools that are training us are aligned with the standards for what a yoga therapist has to know. Okay, so that's step two. That's self-regulation of what a yoga therapist has to know, the competencies, self-regulation of the training programs. Step three, credentialing individual persons. So we say, all right, so your schools are being monitored. Now we say your individuals are also being monitored. So we're self-regulating the individual professionals that come out of those programs. In other words, we're saying, not only did you sit in a room for this number of hours, but we're actually going to attest to the fact that you have the skills and knowledge that are aligned with the profession. The next step, and this is a more recent one, is a qualifying exam, to say, not only has your school said that you meet these qualifications, but we have a standard that is measurable, that says everybody who has gone through this program takes this exam that is being monitored, delivered by an outside third party, right? So it's not us saying, oh, here, take this quiz and you pass, but it's being monitored from an external third party to say everybody who takes this qualifying exam has met this certain standard. And another one, and this actually came earlier, so I'm a little bit out of order here, continuing education requirements and standards for continuing education. And some regulation of continuing education. We could do a much better job of that. But so these are all steps toward qualifying for licensure, should we decide to do it.
So, two questions. One, who decides? And two, up until this point, I think a lot of people have graduated from these schools, which are not set in standard university settings, right? So we're training in a different way than, your PTs or OTs are doing. Have been told that we are going to have some kind of profession and gravitas behind us as we go into the workplace. And I've heard you talk about this before, so I want you to say it again. Have we been sold a bill of goods?
Okay, so one, just because you brought this up and it makes me think of this additional point that I think is important. We don't have to be trained in universities in order to be licensed. So massage therapy is a great example of this. Massage therapy is a licensed healthcare profession. most massage therapists are not getting a master's or a doctorate in massage therapy. So there is already a precedent for training licensed healthcare professionals outside of a university setting. I will say having the university degree is something that people understand, right?
Yep.
So
Yep.
any job that I have been hired for, probably I got it because I have a PhD from Johns Hopkins, not because I have a CIAYT. And so the CIAYT, nobody knows what that is, right?
No.
So it's only as good as its reputation. So, something that I have been saying in various threads and conversations around this is what I think that IAYT should be focusing its effort on is advocating for yoga therapy as a profession, educating healthcare professionals, educating insurance companies, even referral networks,
Yes.
existing healthcare providers.
Yes.
Yoga teachers don't even know what yoga therapy is.
Oh my God, I
So
know.
the general public, the end user, consumer, right? So most people, for example, so low back pain, right, is one of the places where we actually have some pretty robust evidence about the effectiveness of yoga. Do most people with low back pain know that yoga might help them? Probably not. And
Yeah.
most certainly, they don't know the difference between going to a yoga class and getting yoga therapy. And then there's the whole question of like, do they have access to safe and appropriate yoga teaching, right? That's an entirely different question. But the
Yes.
more, so research that is being done by people all over the world, research is growing both in the volume and also in the rigor. The way that the trajectory of research happens is that you ask like really broad, really simple questions first, and then you start getting more nuanced and more complex, more granular as you go. And so we are now at the point where we're starting to compare yoga to established healthcare professions and to say, if we hold yoga up to this other thing that is already accepted as care, how does it do? And guess what? It's at least as good as
Yeah.
the existing standard of care. So the more that research happens, the more there is an interest in yoga. And yet, one, most of these research studies are on yoga and not yoga therapy, or they're on therapeutic yoga, right? A yoga protocol that has been designed for this particular clinical population, not an individual intake and development of a care plan and assessment of like individual goals, et cetera. That happens a little bit. I mean, I do some of it. It takes having CIAYTs on the research team to be able to say, hey, you know what we should do instead? Okay, so all of these things, the research adds credence, the people starting to know what a CIAYT is adds credence, it being in university settings with degrees adds credence, it having a license adds credence. There's not one of these things that is necessary in order for it to be a credible profession, like counseling as a credible profession does require a degree most of the times, doesn't necessarily have to have a license. Massage therapy is credible. It can be trained outside of a university setting, right? So there are different models for established and respected healthcare professions that have some of these pieces and not necessarily all of them. And there's a hierarchy in medicine. So the hierarchy in medicine puts us at like the very, very bottom.
Yep.
Right. So
course.
even the medical doctors who deliver acupuncture, they are lower on the hierarchy than their colleagues who do surgeries, for example, right?
Yes.
And so they are working to gain credibility even within their sort of the weirdos or the outcasts where they are, because they're doing this thing that is a little more fringe, let alone the licensed acupuncturists who have a whole lot more training but less of a reputation in healthcare spaces, let alone a profession like ours, which is non-licensed and integrative. And so, as we take some of these steps toward increasing our credibility, even if we get in there, we're still going to be low on the totem pole. We're still going to struggle to demonstrate that we matter, that we deserve a seat at the table, that people should refer to us, that we should be covered by insurance, et cetera.
Yeah, I mean, I only get referrals from people who just have nowhere else to go. I mean, it is just, it is the, I often refer to, there's one pelvic floor physical therapist in this area who I get a vast majority of referrals to, because she's already like, people are really desperate before they come to a pelvic floor physical therapist.
Right.
And then if she can't get outcomes, she's just like, well, I don't know what to do with them. Go see Rebecca. and like, we are so low on that chain. Like, I mean, people have tried burning incense and crystals before they've come to see me. I mean, so how, first of all, how does that change? To, do we need it to change? Or do we exist somewhere on that sort of like fringe space between what you would say new age seekers and traditional healthcare seekers are doing? Like there's sort of a crack in there that we've seen to kind of slide into. Is that our space? And will we ever be able to take vacations?
Oh my gosh, that last one.
Can I afford to go away?
Okay, so I mean, one, there are people who are succeeding at this.
Yes.
We did at the Symposium on Yoga Research. Were you there, Rebecca?
I was
You don't go to
not, no.
Okay, so we shared findings from a recent survey that some of your listeners may have participated in. So there was a yoga therapy workforce survey that we did years ago during the
that.
grandparenting phase. Okay, so
Yeah.
did you do the one several years ago, or you did the one that we just completed?
I did the one several years ago.
Okay, so we asked questions of people who called themselves yoga therapists. At that time, the IAYT was just getting started. And so some people had it, some people didn't, some people wanted it, some people didn't. That's still true.
Yeah.
So we wrote a paper characterizing the yoga therapy workforce. And we said, here's who it is, here's what they're doing. And then we thought, you know what? Several years have gone by. We have all these schools now. We have this credential. Let's repeat it. And also, there were some things that we wish we would have asked differently the first time around. Let's modify the questions a little bit. Let's try it again. That's going to get published eventually, but we gave a sneak peek of the findings. And the bottom line, we asked a lot more questions about income, and it's not good.
No.
So yoga therapists tend to have a decent household income, but they tend to not have a very high individual income. So in other words, they tend to be in partnership with somebody who makes a better living. And also the amount of time that they spend actually delivering yoga therapy is very limited.
Yes.
Now, we don't know whether that's by choice or by circumstance. So we don't know, is this something that somebody who is a stay-at-home parent is doing for a few hours a week? Is this something that somebody is doing moonlighting? They have a day job that they want. Like, that's my situation. I'm a full-time research scientist, and I see some clients besides, right? So that's by choice, not because I have struggled to be able to get clients, but because I have this other job that I love. So people have lots of different situations, but the vast majority of people who are working in yoga therapy are not making a living wage. They're not working full time, and they're not earning enough money to support themselves. I think that it was something like $13,000 a year was the most common category. So now,
makes me sweat.
That being said, we asked about yoga therapy, and what we every time you do a survey, you realize what you should have done differently. So already we know that one of the things that we should have asked differently was about the portfolio career in
Yes.
yoga, because a lot of people who are CIAYTs are also teaching yoga classes, maybe some that are therapeutic, maybe some that are not, right? They're teaching yoga nidra classes and gentle yoga classes, chair yoga classes. They're doing workshops, they're doing teacher trainings, they're guest lecturers at the local community college, right? So they have this portfolio career, and maybe they actually can make a career out of yoga, but it's not all yoga therapy. We don't have the granularity to be able to answer that question. Uh, there are some very few places where you can be hired as a yoga therapist. The VA I mentioned earlier, the
Yep.
VA is one of those places where you can put in your resume on Indeed and get hired as a yoga therapist. So, and the VA is a model for other healthcare environments. So the VA has this whole health model that has been incredibly effective. They're putting out a lot of research on how effective it's been, how cost effective it's been, which makes it very appealing. And it makes other healthcare systems want to do something similar. The VA is very unique in that it is a single payer system. They provide the care and
Yeah.
they pay for the care, and so they can do a whole lot of things that other health systems can't do. The VA is one of those places. Another one of those places is the Ornish program. So Dean
Yep.
Ornish's heart disease reversal program has been covered by Medicare. And so that is an example of an evidence-based program that has been able to make the case that insurance could cover it. You don't have to be a licensed healthcare professional to provide yoga in the Dean Ornish heart reversal program and have insurance billed for the work that you do. So there are jobs that get posted to be able to be the yoga provider. Now, it's not individualized care, right? It's not yoga therapy, but it is a yoga job in a healthcare setting for a clinical population that is something you can apply for and be hired to. And then there are also some big hospitals that have a yoga program that may have even a full-time yoga therapist who's in charge of that program that may include administering a combination of yoga related services like yoga for the healthcare professionals who desperately need it, yoga for, family caregivers, yoga classes that are tailored to a certain population, like for stress reduction or for diabetes, and also may include individual yoga therapy that the director of the yoga program may be delivering in part or may be hiring people part-time to deliver. So there are places where this is happening in healthcare, and I think that the more evidence that we demonstrate, and frankly, the more people have positive experiences. I mean, how many people have you worked with who have a healthcare condition that has been well
Right.
managed by yoga, who are then
Yes.
advocates for, like, everybody who has this thing that I have should be doing
Yes.
yoga, right? So the more that happens, it sort of creates momentum toward greater interest and demand for and credibility for yoga, that still there is not a clear distinction between all of the different yoga services that are available in the marketplace.
That becomes a really interesting question. How would the IAYT, let's say that they are coming into this situation as wholehearted as possible, open to change, open to shifting their focus, and they want to advocate for the profession. Now, I want to say very clearly, as an organization, they are not legally obligated to do so. That is not their mission or vision. But maybe they could, maybe they should. Like, how would you shift them in that direction? If you were them, what would you do?
So, these like little tote bags that they give out at every yoga therapy
I do. I
conference
have
that
like
say,
three.
like,
Yeah.
ask me about yoga therapy?
Yeah.
That is the kind of start that we need. Like, people have never heard of yoga therapy. Get
Yes.
out there and make this a conversation. What the heck is yoga therapy? So that's like a social media campaign. That's like continuing education for medical doctors, for nurses, for PTs, for OTs, for psychotherapists, social workers. What is yoga therapy? Let them get continuing education credit to learn what yoga therapy is. When, what's the evidence base? When should I refer somebody? How do I refer somebody? How do I find a CIOAT? How do I know if they're a fit, right? So all of this could be education for healthcare professionals. We could do, things in hospitals. You could have IAYT provide training to yoga therapists. How do you go into a hospital and deliver a webinar for the hospital? How do you pitch to a hospital, for example?
Yeah.
How do you do, awareness raising in your community? Let's create a toolkit for yoga therapists to be able to use. So IAYT could be doing things directly, like a social media campaign, like, continuing education for healthcare providers, but they could also be providing information, education resources to yoga therapists so that they can feel more prepared to go out and advocate for the profession. And also, what about a lobbyist? I mean, Yoga Alliance, that for a long time, I don't know if this is still true, but their biggest budget line item was
Yes.
lobbying.
Yes.
Now, the lobbying that Yoga Alliance was doing was to keep regulators away from yoga, which
Yes.
is not necessarily what I think is, yoga in the marketplace is not necessarily safe. And so that's a whole other conversation of how do we ensure that yoga in the marketplace is safe. But is there, do we want to advocate, for example, for NCCIH, the part of the NIH that studies yoga, to study yoga therapy, to look at yoga as a whole system, the way that we could think about Chinese medicine as a whole system, as opposed to, these protocols that are looking at asana? Do we want to advocate for changes in policy for things like Medicare and Medicaid to cover yoga under certain circumstances? Do we want to advocate for freedom of access so that people can have more choice about the types of healthcare that they're able to seek, right? And that's the kind of thing that would benefit not necessarily yoga in particular, but all of the integrative health professions, for people to have choice to be able to, for example, go directly to a chiropractor or an acupuncturist or a yoga therapist or a massage therapist without having to necessarily be referred by their medical doctor because their medical doctor thinks that it's a good idea, but to have the freedom and agency over your own healthcare to say, this is what I think that I need because I know my body and I know about this therapy. So there are things that we may be able to do in terms of advocacy that may improve visibility of the profession and understanding of what we do, and may equip us as a profession to be able to advocate as well.
So that would be a conscious choice that IAYT would have to make to actually shift their designation as an organization, because they're a C3, they're not a government lobbying organization.
Right.
They would have to be a
And
C6.
I'm not necessarily saying that lobbying the government is the best use of resources for IAYT. I'm just saying that is one example of advocacy, and
Yeah.
Yoga Alliance does it. But I mean, I
Yeah.
think just raising awareness about what yoga therapy is to lots of different stakeholders who don't even know they're stakeholders is probably a good place to start.
Yeah. So, okay. Final thoughts here about this. Are we satisfied with so as we're talking today, it is November 6th. We got an email from the IAYT yesterday saying that there is a reevaluation of their credential program. Are we satisfied with where it's at? Are we suspicious about where it's at? Are we I'm suspicious, but I'm naturally a suspicious person. What do we think before we go?
So I I personally know multiple people who work at IAYT, and I think that there is a lot of good intention, and some of it may be misguided or misinformed. I don't think that they are malicious and trying to undercut the CIAYT. I don't think that they anticipated the backlash. And I don't think
Might be
that
my fault.
all parts were talking to the whole. So, for example, things that happened years ago where this was evaluated and people decided that it was not a good idea, it's like one
Yes.
hand not talking to the other. I think that they have heard us. They're terrified. Um, and I think that they want to fix it. And they may have different ideas about what the fixing it looks like. I didn't see the email that I got yesterday. I've been on the research conference circuit. But the last I heard, they had paused the process of accepting new applications, but the programs that existed were still in operation. And what I and others suggested to them is like, you need to shut it down. Like, it's gotta stop. And then you can reevaluate. But until you stop it, you're going to have a hard time. I mean, there's still going to be a lot of trust building that's going to have to happen, a lot of like coming to the table and listening in a way that is less protectionist. I think that if I worked for IAYT, I would have barriers. I would be fearful. I would feel like, caught off guard and attacked probably. What it kind of saddens me the way that some of the yoga therapy community has responded to this out of anger. And I suggested to some people at IAYT, like, I think that you can't separate out what we found in that survey from the reaction that people are having. People can't make a living.
Yep.
And so we are in a place of like scarcity, not just scarcity mindset, but actual scarcity, right? You're saying, can I take a vacation? If we can't practice what we preach and take care of ourselves because we're worried, are we going to be able to buy groceries? Then, we're talking about some root chakra stuff. And so while we would all like to be able to show up as our best selves, when you're in fear and scarcity, that can be hard to do. So I do think that there has been some ugliness that has come out in response to this that is coming from a genuine place of fear and scarcity. And I do hope, if anybody can navigate this, I hope that we all, with our yoga practices and with our yoga training, can take a breath and use our yoga tools to meet each other and figure this out together. It happens in every profession. This, like, forming, norming, storming, reforming, or whatever the order is. You look at PT, you look at the medical profession that, had factions of, if you look at like the history of naturopaths versus the MDs, DOs, what happened in chiropractic, what happened in psychotherapy with the different schools of psychotherapy warring with each other. Like, this is pretty typical stuff as a profession grows and becomes more visible and more of a career path. Yoga therapy was not necessarily an understood career path for a long time. And so as that happens and people are expecting to be able to make a career from it, and there are standards in place, there's going to be, turf war, there's going to be different ideas of how we should move forward. And I would like to think that if anybody can get through this as a whole, instead of splitting up into warring factions, it would be us. That remains to be seen.
I love how you said that. I love that it's worth us discussing that there is a tension to be had here, and tension and discomfort is not always a bad thing. It propels us in the direction that we need to go because we can't stand still. We have to. Now, I understand very clearly my role is to push some tension here, and that's like I
We love
understand
you
the
for
assignment.
it. We're glad that you do that. Yeah.
But my hope, and I think all of our hope, is that we push ourselves forward in a profession in a way that 10 years down the line, there's no question that we see a way that we can eat. We're doing too
Yeah.
much good work. I know you were at SIR this year, and I just saw Mona Flynn 2 weeks ago talking about her work with refugees who are coming to this
Mm,
country. We do too much good work for us not to push ourselves forward as a career.
yeah. Amen. Thank you.
Tell everybody where to find you, Steffany,
Yeah.
so we can all
So
fangirl.
my yoga therapy work, I'm a continuing education provider. I have a couple of books out. All of my yoga and yoga therapy related stuff you can find at arthritis.yoga. Just arthritis.yoga. There's no com in
Yep.
there. Arthritis.yoga. And if you're interested in what we're doing at the university and the research stuff that we're doing, including this grant that we have around acupuncture under Medicare or some of the other related work, that university address is scuhs.edu. So that's Southern California University of Health Sciences.edu.
Thank you so much for coming on and having this conversation. I really appreciate it.
Thank you for having me.
Okay, as always, I am obsessed with how much I love talking with you, Steffany. Thank you so much for this conversation. Here are our key takeaways. First, this point cannot be stressed enough when talking about license within the yoga therapy space. Just because you have a license does not mean that you can necessarily bill insurance. So let's uncouple those thoughts, my friends. Please and thank you. Next, we can learn from the journeys of other professions. We dove into acupuncture with Dr. Moonaz, and it is fascinating to hear the stories of professions where there are restrictions about who they can treat, how they can treat those people, and who supervises the practitioners. What are your thoughts here? I'd love to know. Next, where the IAYT, or International Association of Yoga Therapists, seems to be missing the mark is in understanding how people in yoga therapy find their clients through the referral process. Now, I have said this before, but the amount of LHCPs, or licensed healthcare providers, who have said to me to my face, I'm just going to go and get a 200-hour teacher training certification to do what you do, is staggering, my friends. So staggering. Now, I still get referrals from most of those folks because eventually they realize that that just isn't the case. But the fact that I have to explain this to an organization that represents our industry is frankly wild to me. That's just not how it works for any of us on the ground. So taking clients, so those of us who that's just not how it works for any of us on the ground. And for those of us taking clients as yoga therapists, the referral process can be incredibly tricky. Next, Gravitas and money, my friends. Every single conversation I'm having on this series, we talk about those two things: what it is for us to be taken seriously for our work, and can we pay for basic living expenses? These are, in total, the things that we really want. Next, Steffany said something I really want to emphasize. We can, as a profession, take the steps needed to become a licensed profession and then decide not to do it. But in my opinion, actually, it's well worth taking the steps to professionalize as a whole. It benefits us as an industry in the long run. Next, we do need to give the IAYT credit where credit is due. The steps that they've taken thus far in the area of self regulation are significant. The accreditation process for schools, the credentialing process for yoga therapists, continuing education requirements, core competencies, these are all important steps in the development of yoga therapy as a profession. There is no doubt about it. So kudos to you, IAYT, for some, but maybe not all, of the work you've done so far. Next, how do we distinguish the difference between all the varying services in the yoga marketplace? This is a huge question, especially in the context of yoga therapy, when I myself have to explain to my teachers who work for me at my studio what yoga therapy actually is. So, what ideas do you have? If you have some ideas on that thought, feel free to email me, Rebecca@workinginyoga.com. I would love to hear from you and have you let me know. Next, this is the time where I remind you that the IAYT, or International Association of Yoga Therapists, has no legal requirement to advocate for us as professionals. Their designation is a 501c3 organization, which is a public serving organization in the United States. Just as a note, this comes up about 2/3 of the conversations in this entire series, and that is an important note to make. And finally, just to update you, we still have no official stance from the IAYT as to whether or not the Q designation has stopped completely. And this is a month after Steffany and I have recorded this. Just in case you were wondering what an update was, there is no official stance that has come out from the IAYT in this regard. Now, next week on the podcast, I have Michelle Lawrence, Director of Inner Peace Yoga Therapy, on, and she's talking about her experience with the IAYT and the Q designation as one of the first people to call out the IAYT for doing something that could potentially damage our industry, as well as Michelle provide some ideas for our future. Now, I will meet you back here at break time, my friends. Until then, please know that I am so grateful that you listened, and I will catch you around the water cooler next time.